I think it's based. I don't think it's necessarily a disease. I think if your family is obese necessarily, then it's kind of like an upbringing. So I would say more of like a disorder than a disease.
Okay, cool.
I think it's like social. It's your surroundings based on that.
I think that obesity is a disorder because I feel like you could always get help for that. You know, like at least have someone like push you to exercise more, eat right. But then, I mean, like, it could be a disease in that it's hereditary to a certain degree, but I feel like you could always, cause I mean, some people are just gonna be, they're born like bigger boned or whatever, but I feel like you can always be healthy even if you're gonna be larger. Obesity is not really healthy, so to prevent obesity, I think that you could get with like Weight Watchers or something, like a weight loss program, or you could get a trainer at the gym, or you could even have like a friend or a loved one like go on a diet with you, or just like be there to like encourage you to do well.
I think it's a disorder. I think that people could get out of obesity if they tried and had better habits.
Yeah, you can definitely control it. I mean, you can control your eating, even if they like maybe your parents are bigger and like in your DNA a little bit, you can still control yourself and exercise.
I think that being bigger, like that, like to a point, but
yeah,
the obesity it's reached. I feel like overweight might be hereditary, but the point of obesity
that's like
can
way
be
past
controlled.
being overweight. Yeah.
Well, personally, I think it's a disorder. I mean, anyone has the will to, I guess, step away from the plate, slide their chair back and say, you know, that's enough for me. I guess it's just depending on the person, how they feel about their life, and if they want to stop, they can control themselves. So it's like all in the mind.
Yeah, I mean, I feel the same way. I feel like it's a disorder. And also, it might just be like your environment. You know, some people eat a certain way, and that promotes obesity. Like, you can't help. You really can't help it. Sometimes you have a choice of what you eat. You know, your mom cooks one thing for dinner. You know, that's just what you're gonna eat. It's like that. It's a lullaby. Ooh, it's a lullaby.
Oh, I guess I think it's a disease because I feel like, I mean, in general, like I know like most people, like, you know, you have healthy people and unhealthy people, but I mean, for most people, like, I don't think it depends on like what you eat. Like, I think some people just can't help, and it's like genetically in them that it's a disease and they can't control how big they get or whatever. So, okay, cool.
The ocean is where
I think obesity is a disorder rather than a disease because I mean, you can do something, you know, out of your own free will to like fix that problem. While in a disease, you can't change that as easily. It is hereditary, but people are just like predisposed to certain things on it. So it's up to the person to
this isn't a definite answer, but like a mixture of both, because like there are definitely fat people who are born fat, like they can't get rid of the fat, but then there are people who just eat too much and they know they eat too much. So I can't like, I don't have like a definite answer, but like, does that make sense?
Yeah, yeah.
Okay.
Okay.
So I would say both, like.
It's like a combination almost.
Where like if this person's fat, if it's just they like to eat a lot or they have emotional issues like people with anorexia do, or if they were born like their parents have like you know fat friends in their family or something.
Cool.
all I need is this moment.
disease being something out of
Obesity is a
control?
disorder because I honestly think that someone that puts food into their mouth can control which food they put into their mouth. And I understand that some people, if person A puts 2 hot dogs into their body, they'll get more fat percentage out of that compared to person B who puts 2 hot dogs into their body. So that basically breaks down to metabolism.
Okay.
So some people's metabolisms are slower than others. But honestly, if you have a slow metabolism, then you should not be putting hot dogs into your body. Okay?
Okay. So wait, doesn't that mean that you would be saying that it's hereditary?
No, that means
it's not in your DNA just because you have a higher or lower metabolism?
Metabolism is hereditary.
Okay.
But basically, obesity is understanding what your body is and playing off of that. So, like, that's not well worded, but if you're obese, you ate too much and what your body could handle. Like, I don't know. It's hard to describe.
So you think it is a disorder? It's something controllable?
Yes, because obesity is a high fat percentage of the human body.
Yes.
So, if you eat too much food that has a high fat content and you don't exercise to burn off that fat content, then you're going to have that extra fat on you. So the specific person, which is different for every person in the world, should, over the span of 15 years, understand what makes them fat and not fat. So I understand if their parents, if they weigh an obese amount from birth, that's their parents' fault.
Yes.
But once they get into basically high school, in high school you can understand what you can eat that makes you fat. So, if you're in grade school and you're obese, if you're obese and you're in high school, it might be the result of obesity in middle school, but you could definitely cut down your obesity in high school by not eating fatty foods, which the public schools provide. Public schools have horrible health lunch selection.
Okay.
So you really got to take it into your own hands. So, what was the original question?
Do you think obesity is a disease or a disorder?
Yeah, obesity is a disorder based on the parents' habits, and then your habits based on what your parents taught you.
Okay.
End of story.